It's my proud privilege to welcome you all to this inaugural program of Health Financing Forum for Cross-State Learning in Northeastern region. Today marks a significant milestone not only for the Nagaland Health Project, but also for our journey of shared commitment to improve health outcomes, strengthening health system, and building the resilient communities. The gathering is an opportunity to reflect critically and collaboratively on lessons learned, innovations piloted, and challenges encountered. I'm sure the insights will help in shaping stronger, effective health policies and practice in future. Result-based financial approach, where payments are made only after predefined and measurable results have been attained, as compared to the input-based financing system, RBF is tying prices to actions and pays based on the quality and quantity of the services provided, and thus enabling efficiency and transparency for the public delivery system. Nagaland Health Project, with invaluable support and funding from World Bank, was envisioned to strengthen the health system, improve service delivery, and empower communities at the grassroots level. The project, implemented by Department of Health and Family Welfare, which began in 2017, piloted the result-based financing to improve access to the basic health services. The project, which concluded in 2024, initiated RBF-linked funding to primary and secondary health facilities to promote better management practices and community involvement and increase service coverage. Catalyzing the nuances on the public financial management by introducing the flexible funding mechanism for the health facilities and thus directly linking to the achievement of specific health targets. The approach has simultaneously addressed the persistent challenge of limited funding and inefficiencies associated with the input-based approach. The RBF has provided valuable lessons in both governance and health sector financing, demonstrating that how performance-linked disbursement can improve resource allocation and induce effective service delivery. The primary objective of the event is to facilitate exchange of implementation experiences and analytical insights on health financing reforms in Nagaland, thus fostering mutual learning in the northeastern region states. Dissemination of the key health financing studies and RBF reforms will benefit stakeholders across the northeastern region. The project has led to improved understanding of state-level challenges in the financial management and RBF implementation, with strategies for scaling up reforms towards universal health coverage. As we go through the sessions, I encourage everyone to engage deeply in the discussions and sharing of experiences. Let it be a true forum for not just what worked, but how we need to improve. I'm sure a lot of learning coming our way. I once again warmly welcome you all and thank you for being part of this important dialogue. Thank you.
Everyone, it's a privilege for the World Bank to be here today in Nagaland. We are very proud to support the Government of Nagaland in hosting the Health Financing Forum for Cross-State Learning in the Northeast. So over the past decade, as some of you might know, we have worked very closely with the Government of Nagaland, but as well other northeastern states to advance several health reforms, which were actually mentioned before. So this region, as you might know, has faced several challenges, being difficult terrain, extreme weather events, and historically as well, low health spending. So despite these hurdles, despite all these many challenges, the Northeast has actually showed very strong resilience, which again was mentioned before, and a very strong community spirit. And all of these have actually been key drivers of those very successful health reforms. There is a lot to learn here. Nagaland and Mizoram, for example, have introduced universal health insurance, which is usually a very difficult health financing reform, to put in place. And here, this has actually ensured access to hospital care without financial hardship. So this is, this type of reform is really an important step toward universal health coverage. On the supply side, states like Assam, Mizoram, Meghalaya, and Nagaland have been testing result-based financing, RBF, at primary healthcare level or secondary healthcare level. There are very few other Indian states which have managed actually to pilot such kind of complex health system reforms. So that's why we are here today. The Northeast actually offers very important lessons. These are not widely well known, but can actually help guide other Indian states and even other countries, especially those expanding, PMJ towards universal coverage. So sharing what has worked, but as well, more modestly, what has not worked, can save time, money, effort, but as well lives. So this forum, led by the government of Nagaland, brings together all of you here today. Policymakers from the Northeast, but as well from outside the Northeast. From the center, we have our dear colleague from DA, as well, academics. So the goal of today is really to exchange real-world experience and research on universal health coverage and health financing. So the focus is a bit more on health financing reform. So we really want this discussion to be meaningful, honest, and even provocative. For instance, should result-based financing be scaled up? Under which conditions? Can it be sustainable? So we really need to have all this discussion around those key health financing reform and ask ourselves those critical questions. How do we make it sustainable to improve lives of people? So we'll also highlight some key findings of some of the recent analytical work that many of you here have been leading. For instance, several analytical work around universal health insurance in Mizoram, in Nagaland. Some other work around implementation research on RBF in Nagaland, in Meghalaya, in Mizoram, and in Assam. We'll go through as well some other studies you have done in the area of governance, public financial management in health, like in Nagaland in particular. And as well, we'll look into some work which has been done on climate health and financing. So again, a very warm welcome to this workshop, full of promising practices and bold ideas. We hope you leave inspired with practical insights that you can take back to your own state and hopefully apply to your state again to save lives. So one very last thing, we are very, very grateful for the strong participation from Northeast states, but as well from international colleagues. I know it took a lot of effort to have everyone here in this room. So again, it's a true privilege to support the government of Nagaland hosting such event with a diverse group, and I hope we can really make the most of it. Thank you.
Among all the departments in the country or all over the world, the most important department is health and family welfare. Healthcare is most important. Education is for certain group of age, school education, college, university, for certain age of group. Sports, only for certain age of group, not for all ages. But healthcare is from oldest to the youngest. It covers every population. So we take it that this department is the most important department among all the functionaries department. So I think we should take it as important because it is for every section of people. Even the oldest man among the society. He don't want to die early till he breathes last, including disabled people, handicapped people. They don't want to die. So today, health conscious become very important for all over the world. So I think it is a very important interaction. It's a privilege to join you in Dimapur, now Chumukadima, for this important gathering on health financing reform for cross-state learning in the Northeast region. Your presence reflects a shared commitment to strengthen the foundation of health systems across the region, systems that are equitable, efficient, and resilient. The Northeast region, with its rich cultural and ecological diversity, is home to over 52 million people. Yet, despite its promise and potential, the region continue to face structural challenges that constrain growth and equitable development. The predominance of rural livelihood, difficult terrain, and limited connectivity make service delivery uniquely complex. These challenges are compounded by climate change, a reality that is already altering disease patterns, food systems, and disaster risks across the region. In health, these factors converge sharply. Maternal mortality remains unacceptably high. Childhood illness too often go untreated. And non-communicable diseases, cancers, and cardiovascular conditions are emerging as major causes of death. The health of our people is both a reflection and a determinant of the region's social and economic well-being. Yet, it is equally important to acknowledge the remarkable progress achieved in the recent years. The Northeast has not stood still. It has innovated. In 2017, the Nagaland Health Project, supported by World Bank, broke new grounds by introducing result-based financing for the first time in the region, linking funds to performance, not input. Soon after, with support from World Bank, our neighboring state of Meghalaya, Mizoram, and Assam implemented the internal performance agreements, each adapting the model to local needs. At the same time, Nagaland and Mizoram have expanded social health insurance beyond targeted groups, moving towards universal health protection, a bold and progressive step that aligns squarely with India's vision for universal health coverage. Meanwhile, several Indian states, including Nagaland, have undertaken public finance management assessment to diagnose bottleneck in planning, budgeting, and expenditure reform that may not grab headlines, but which are essential for the long-term sustainability of health system. This workshop is about connecting these experiences, learning from one another's journey. Each state in the Northeast has taken different paths towards improving health financing and service delivery. Some have focused on insurance coverage and equity, others on accountability and performance, and yet others on strengthening governance and public financial system. We are also deeply honored by the presence of Government of Gujarat, whose pioneering work in public financial management and health system governance offers valuable lessons for all of us in the Northeast. Their participation underscores the spirit of cross-state learning, where insight flow not only within the region, but across regions, enriching India's collective journey towards better health financing and service delivery. By bringing these stories together, we not only celebrate what worked, but also candidly examine what has not, and the challenges of sustaining RBP, aligning incentives, or building institutional capacity to manage performance-based fund. Cross-state learning allows us to shorten and learning curve. It transforms individual experiments into collective progress. And it helps us identify scalable models that can be replicated, not just within the region, but across India and globally. As we convene over the next few days through panel discussion, technical sessions, and field visits, I hope we use this opportunity to identify what works best in different contexts across the region, to strengthen collaboration between health, finance, and planning department, and chart a shared roadmap for scaling up reforms that move us closer to universal health coverage. I hope this workshop is not the end of a project cycle. It is the beginning of a new phase of cooperation, one where data, evidence, and dialogue drive policy. The road to universal health coverage in the Northeast may be long, but it is within reach if we continue to innovate, learn from one another, and invest in systems that place people, especially the most vulnerable, at the center. I commend the Department of Health and Family Welfare, Nagaland, the World Bank, and all participating states for making this interface possible. Let this forum be remembered as a moment when the Northeast came together, not just to discuss reforms, but to build a shared vision and a healthier, more resilient future. I wish all the participants to interact with each other, and the outcome will be successful for the region. Thank you, and God bless you.